Have you ever wondered if the warning signs of one of the deadliest cancers are already showing up in your body without you realizing it? Every year, pancreatic cancer claims the lives of thousands of older adults, yet many of them notice the early symptoms months before receiving a diagnosis. The tragedy is that these warning signs often look so ordinary that they are blamed on aging, stress, digestive trouble, or an old injury. While people convince themselves they simply need more rest or a change in diet, the disease continues to grow unnoticed. What makes pancreatic cancer especially dangerous is not that it cannot be treated, but that it is usually discovered far too late. By the time many patients finally receive the right tests, valuable opportunities for early treatment have already been lost. Today, I want to walk you through 8 important warning signs that every adult over 60 should know. One of these symptoms is so commonly overlooked that many people never realize its importance until it is too late. Stay with me until the end because each symptom builds on the last, and together they paint a picture that could help someone seek medical attention while treatment is still possible. Before we begin, there is something you need to understand about why pancreatic cancer is so difficult to detect. Unlike many other organs, the pancreas is hidden deep inside the abdomen. You cannot feel it from the outside. And during a routine physical examination, your doctor cannot simply press on your stomach and detect a problem. Even standard yearly blood tests often fail to reveal pancreatic cancer until it has already spread beyond the pancreas. This is exactly why the disease has earned its reputation for being one of the most challenging cancers to catch early. Instead of announcing itself with obvious symptoms, it quietly disguises itself as common health problems that many seniors already experience. Recognizing these early clues can make an enormous difference. The first warning sign is dark urine that keeps returning for no clear reason. Many older adults notice that their urine suddenly becomes much darker than usual and immediately assume they are dehydrated. They drink more water, and the urine appears lighter for a short time. Believing the issue has been solved, they forget about it. Unfortunately, that simple explanation can sometimes delay the diagnosis of something far more serious. Inside your body, the pancreas sits very close to the bile duct, a small tube responsible for carrying bile from the liver into the intestines. Bile contains a substance called bilirubin, which gives stool its normal brown color and urine its usual yellow appearance. When a tumor develops in the head of the pancreas, it can press against the bile duct and partially block it. As a result, bilirubin cannot flow normally into the intestines. Instead, it builds up in the bloodstream, and the kidneys attempt to remove the excess through the urine, causing it to become dark, yellow, brown, or even tea-colored. The most important detail is that this change often keeps coming back. Drinking water may temporarily make the urine appear lighter, but because the blockage remains, the discoloration returns again and again. Water cannot remove a blockage caused by a growing tumor. If you have noticed urine repeatedly becoming unusually dark for more than 2 weeks despite staying well hydrated, do not assume it is simply dehydration. It is a symptom worth discussing with your doctor as soon as possible. Understanding this single warning sign could completely change the direction of your next medical appointment. But the next symptom is even more deceptive because countless seniors have already been treated for it under the wrong diagnosis without realizing what was truly happening. What makes the second warning sign so dangerous is that many people have already talked to their doctor about it, received a diagnosis, taken medication, and gone home believing everything was under control. It is often blamed on arthritis, a strained muscle, an old back injury, acid reflux, or simply the aches that seem to come with growing older. Unfortunately, while attention is focused on treating those common conditions, pancreatic cancer may continue progressing silently. The pain caused by this disease follows a pattern that is very different from ordinary back pain, and recognizing that pattern can make all the difference. Instead of beginning in the lower back, pancreatic cancer pain usually starts as a dull, steady ache in the upper abdomen, just beneath the breastbone or slightly toward the left side. At first, the discomfort may seem mild enough to ignore, but over time it becomes persistent. What makes this pain unique is the way it spreads. Rather than remaining in one place, it wraps around the body and travels into the middle of the back. Many patients describe the sensation as though a tight band is being pulled around their torso. This happens because the pancreas is surrounded by an extensive network of nerves. As a tumor enlarges, it places pressure on those nerves and nearby tissues, sending pain signals outward in several directions instead of remaining confined to one spot. There are several clues that help distinguish this pain from ordinary muscle or joint problems. The first is that it frequently becomes worse after eating. About 30 to 60 minutes following a meal, the discomfort often increases noticeably. This is because eating stimulates the pancreas to release digestive enzymes. When the organ is affected by a tumor, that normal activity can intensify irritation and pressure, making the pain more severe. Many people never connect their meals with the discomfort because the pain does not appear immediately, but the timing is an important clue. The second clue is that lying flat on your back often makes the pain much worse. Many older adults unknowingly begin sleeping in recliners or stacking several pillows behind them simply because they feel more comfortable that way. They may never stop to ask why changing positions provides relief. In reality, lying flat can increase pressure on the inflamed pancreas and surrounding nerves, while sitting upright or leaning forward may reduce that pressure slightly. The third clue is that the pain rarely responds the way normal back pain does. Heating pads, anti-inflammatory medication, rest, or gentle stretching may provide little or no lasting relief. The discomfort returns with the same intensity because these treatments only address the symptom, not the underlying cause. When pain continues, despite the usual remedies, it deserves a closer look rather than repeated assumptions that it is simply another sign of aging. If you recognize this pattern, pain beginning in the upper abdomen, spreading into the middle back, becoming worse after meals, intensifying when lying flat, and resisting common pain treatments, it is important to describe those exact details to your healthcare provider. Being specific can completely change the type of evaluation your doctor recommends. Those details may prompt imaging studies that otherwise might never have been considered. The next warning sign is equally important because it often appears during something as ordinary as sitting down for dinner. Many people believe their appetite has naturally decreased with age, but sometimes the problem is not a loss of appetite at all. Instead, the body is sending a signal that something is physically interfering with the digestive system. Understanding why this happens could help explain unexplained weight loss before it becomes severe, and that is exactly where the next symptom begins. You sit down to enjoy a meal, take only a few bites, and suddenly feel completely full. You push your plate away, telling yourself that your appetite simply is not what it used to be. Many older adults accept this change as a normal part of aging, but in some cases, it is anything but normal. Feeling full after eating only a small amount of food can be an early warning sign that deserves careful attention, especially when it appears together with other symptoms we have already discussed. As a pancreatic tumor grows, it does not always remain confined to the pancreas itself. The stomach sits directly in front of the pancreas, and as the tumor enlarges, it can begin pressing against the back of the stomach. This physical pressure reduces the amount of food your stomach can comfortably hold, creating the sensation of fullness much sooner than usual. At the same time, the pancreas may no longer produce enough digestive enzymes to properly break down food. Without these enzymes, food remains in the stomach longer than it should, slowing digestion and making you feel full even after eating only a few bites. This combination creates a chain reaction throughout the body. Because you feel full so quickly, you naturally begin eating less. Since digestion is no longer working efficiently, your body also absorbs fewer nutrients from the limited food you do consume. As days turn into weeks, the weight begins to fall away without any effort. Some people even welcome the weight loss at first, believing they have simply become healthier or are eating more carefully. In reality, unexplained weight loss is one of the most significant warning signs doctors watch for when evaluating serious illnesses. Medical experts generally consider losing more than 5% of your body weight over a period of just 2 or 3 months without intentionally dieting or exercising to be a major concern. For example, if someone who weighs 200 pounds loses 10 pounds without trying, that should never be ignored. The body does not simply discard weight for no reason. Something is causing that change, and identifying the cause as early as possible can be critical. Another important warning sign involves changes in the appearance of your skin and eyes. This condition is known as jaundice, and it develops when bilirubin builds up in the bloodstream because bile can no longer flow normally. As bilirubin levels continue rising, the skin gradually develops a yellow tint. The whites of the eyes often become yellow as well, sometimes even before changes in the skin are obvious. In people with darker skin tones, the yellowing may be easier to notice in the eyes or the palms of the hands than on the rest of the body. Jaundice can also cause severe itching that seems impossible to explain. Unlike an allergic reaction, there is usually no rash, redness, or visible irritation. Moisturizers and allergy medications often provide little relief because the itching is not coming from the surface of the skin. Instead, excess bilirubin deposited within the skin irritates tiny nerve endings, creating persistent itching that continues until the underlying blockage is treated. The difficulty is that jaundice caused by pancreatic cancer often looks nearly identical to jaundice caused by gallstones, which are very common in adults over 60. Both conditions may produce yellow skin, dark urine, and intense itching. Because gallstones are far more common, doctors may initially focus on that diagnosis, unintentionally delaying further testing. This is why it is so important to mention every symptom together rather than describing each one separately. Dark urine, upper abdominal pain spreading to the back, early fullness after meals, unexplained weight loss, and yellowing of the skin or eyes create a much clearer picture than any single symptom alone. But there is another warning sign that many people never connect to the pancreas, even though it can become life-threatening long before cancer is ever diagnosed. One of the most overlooked warning signs of pancreatic cancer has nothing to do with the stomach, the back, or even digestion. In fact, it often appears in the legs, and many people never realize it could be connected to a problem deep inside the pancreas. An unexplained blood clot can sometimes be the very first signal that something serious is developing. For some patients, this occurs several months before pancreatic cancer is finally discovered, making it one of the earliest opportunities for diagnosis if the connection is recognized. Cancer cells can release substances into the bloodstream that change the way blood clots. Instead of flowing normally, the blood becomes much more likely to form clots even when there is no obvious reason. The most common place this happens is in the deep veins of the legs, a condition known as deep vein thrombosis, or DVT. A person may suddenly notice swelling in one calf or thigh, warmth over the affected area, tenderness, or a dull aching pain that refuses to improve with rest. Because there has been no recent injury, surgery, or long period of travel, the clot may seem completely unexpected. The greatest danger comes when a piece of that clot breaks loose and travels through the bloodstream into the lungs. This medical emergency is called a pulmonary embolism. It can cause sudden shortness of breath, sharp chest pain that becomes worse with each breath, a racing heartbeat, dizziness, or even collapse. These symptoms require immediate emergency medical care because they can quickly become life-threatening. Studies have shown that in a significant number of pancreatic cancer patients, an unexplained blood clot appeared months before the cancer itself was identified. That means a simple question about the pancreas during the initial evaluation might have led to earlier imaging and an earlier diagnosis. If you or someone close to you has experienced a blood clot without a clear explanation, it is reasonable to discuss whether additional evaluation, including abdominal imaging, might be appropriate. This is not about assuming the worst. It is about making sure an important possibility is not overlooked while there is still time to act. Another warning sign that often slips under the radar is a pattern of recurring low-grade fever. Many people assume they have caught a mild virus because the fever appears, disappears, and then returns a few days later. However, infections usually improve and eventually resolve. A fever that repeatedly cycles in and out without a clear cause deserves a closer look. Pancreatic cancer can trigger ongoing inflammation throughout the body. When the bile duct becomes blocked and inflammation continues around the pancreas, the immune system remains constantly activated. Instead of producing a high fever that leaves you bedridden, the body may generate repeated episodes of mild fever, chills, and fatigue. You may suddenly feel cold, even in a warm room, begin shivering unexpectedly, and later notice your temperature climbing slightly to 99 or 100 degrees Fahrenheit. After several hours, the symptoms improve, only to return again days later. Many people also experience night sweats during this time. They wake up with damp clothing or sheets despite sleeping in a comfortable room. Because the symptoms come and go, they are often blamed on minor infections, seasonal viruses, or simply getting older. Yet recurring fever combined with unexplained weight loss, fatigue, abdominal discomfort, or jaundice creates a much more concerning picture. When repeated fevers continue for weeks and doctors cannot identify an infection, the next step should not simply be another course of antibiotics. It should include looking deeper for an underlying cause. Imaging studies can sometimes reveal problems that blood tests alone cannot detect. Recognizing the difference between a temporary illness and a recurring warning signal may prevent valuable months from being lost. But there is another symptom that quietly affects almost every aspect of daily life, draining energy hour after hour until even the simplest activities begin to feel exhausting, and that is where the next warning sign begins. You may think you are simply getting older because you feel tired all the time, but persistent exhaustion that refuses to improve with rest is very different from normal fatigue. Many people sleep 8 or 9 hours, wake up feeling completely drained, rest again during the afternoon, and still struggle to complete even the simplest daily activities. Walking to the mailbox, climbing a single flight of stairs, carrying groceries, or standing long enough to prepare a meal suddenly feels much harder than it did only a few months earlier. While aging can certainly reduce energy, cancer-related fatigue has a unique pattern because the body is constantly fighting a disease that is consuming valuable nutrients every hour of every day. Pancreatic cancer cells compete directly with healthy tissues for glucose, proteins, and other nutrients. Instead of those nutrients reaching your muscles, brain, and vital organs efficiently, a growing tumor uses them to fuel its own growth. Even when you are eating enough and sleeping well, your body may still feel as though it is running on empty. Unlike ordinary tiredness caused by stress or poor sleep, this type of fatigue does not improve after resting. It lingers day after day, becoming heavier and more overwhelming until normal activities feel unusually difficult. If you have experienced persistent exhaustion for several weeks without a clear explanation, it deserves medical attention rather than being accepted as another unavoidable part of getting older. The final warning sign appears somewhere many people rarely think to look: the bathroom. Your pancreas produces digestive enzymes that are essential for breaking down fats. When a tumor blocks the pancreatic duct, these enzymes cannot reach the small intestine, preventing fats from being digested properly. As a result, the appearance of your stool changes in several noticeable ways. Instead of its normal brown color, it may become pale, gray, or clay-colored. Because undigested fat remains in the stool, it often appears greasy, floats in the toilet instead of sinking, and may leave an oily film on the surface of the water. The odor also becomes much stronger and more unpleasant than usual. These changes are not simply the result of eating a rich meal. They are mechanical signs that the pancreas is no longer functioning as it should. Many people also develop nausea after eating fatty foods, a feeling of heaviness after meals, occasional vomiting, and increasing discomfort in the upper abdomen. Since fats are no longer absorbed properly, the body also struggles to absorb important fat-soluble vitamins, leading to even more weight loss, weakness, and fatigue. If pale, greasy, floating stools continue for more than 2 weeks, they should never be ignored. Contacting your doctor promptly may lead to testing that identifies the underlying cause before the disease progresses further. If you recognize 2 or more of the warning signs discussed in this video, do not panic, but do take action. Write down each symptom, note when it began, how often it occurs, and whether it has become worse over time. Bring that information to your healthcare provider instead of simply saying you have not been feeling well. Specific details help doctors decide which tests are most appropriate. If necessary, ask whether imaging studies such as a CT scan or abdominal ultrasound should be considered. Early detection can dramatically improve treatment options, and acting promptly may make all the difference. Remember, these symptoms do not automatically mean you have pancreatic cancer. Many common conditions can cause similar problems. However, ignoring persistent warning signs because they seem like normal aging can delay the diagnosis of serious illnesses when early treatment is most effective. Listen to your body, trust persistent changes, and never hesitate to seek professional medical advice when something does not feel right. If you found this video helpful, please subscribe, and turn on notifications so you never miss important health information. Share this video with your family and friends, especially those over 60, because one conversation and one timely doctor's visit could make a life-changing difference.